Thank you, Bob. It's really nice to be here today, and it's an honor to speak at the joint meeting here of this roundtable and the IAPHS. So Bob asked me to talk about recent trends, and what he meant by recent trends was trends that have occurred since these 3 volumes shown on the slide there were published by the National Research Council, and they were reports that were done under the auspices of the National Academy of, I don't know whether, maybe it was still IOM, the National Academies of Medicine and the National Academies of Sciences, and they were done in 2010, 2011, and 2013. So in these volumes, which really began to document the differences between the U.S. and other countries, what we determined was that life expectancy in the U.S. was very poor relative to what you would consider comparable countries, and it was falling, so that our relative status in terms of life expectancy was dropping over time, so that by the end of the period we studied, which was about 2008, this is the red dot is life expectancy in the United States, and it's relative to the other dots. The U.S. was falling to the bottom. And that's the same picture for women, and the fall is essentially even greater, the relative fall. And you'll also see there that the level of life expectancy is fairly, the increase is fairly slow over this 30-year period. So that's where we started looking for what's been happening recently. And the update to that is the U.S. is continuing to get worse relative to other countries. And if anything, the situation has become markedly worse in only a few short years. So now it's hard to know where the U.S. ranks in life expectancy, depends upon what countries you actually put in the mix, but here, this is a figure that goes out to 2016, and it comes from the World Bank, life expectancy measures, and here we're ranking 36. And we took out a number of small island nations in order to rank us 36. It could be 40. Some people say we're 42. In 1980, we ranked 21st, and now we rank 36. If you look at the level of life expectancy in countries that rank higher than we do now, so the very end of this figure is the U.S. ranking 36, and it shows the 35 countries that are in front of us in life expectancy. Most immediately, you see Chile and Lebanon, who have made tremendous gains. They were quite behind the U.S., and now they move forward. That's also true of countries like Korea and Singapore. So many countries have passed us, and those that were in front of us have stayed in front of us. So the U.S. has a level of life expectancy that is extremely low relative to other countries. So that is the focus of what I'm going to talk about. I'm going to stick with mortality. There are other indicators of health, but mortality is so hard and fast that it's good to really delve into this. So in the last 2 years, there have been absolute decreases in life expectancy in the United States. They're very small, but we never expected that we would actually see decreases in the absolute level of life expectancy. So that's another indicator that things are getting markedly worse. When you look at the trends in life expectancy for different groups of the population, you see that some do markedly worse than others. Women do worse than men. People with low education do worse than those with high education. Whites do worse than blacks. and the south and the middle of the country does worse than the coast. So there are large differences and there are growing inequalities on a number of dimensions around the country. I'll show you some data to document those points that I just mentioned, and I'll try to do two things at once. This shows that men increase in life expectancy more than women, and that people with higher education increase more than those with lower education. So what you have on the figure is the increase, or the change in life expectancy over 20 years, and there are 4 education groups, and the orange-colored bars are for women, and the blue-colored bars are for men. In each case, the blue bar is more positive than the orange bar, meaning men have gained more in life expectancy than women. And most notably, the lowest education group, 0 to 11, women with very low education have actually seen a decrease in life expectancy over this period of time. So this is the group that is experiencing the worst change. And this is for white women. And the changes for blacks I'll show now. One of the better trends in the U.S. is a lessening of the gap between white and black life expectancy. The lessening of the gap, of course, is occurring partly because white life expectancy has stopped improving very quickly. Black life expectancy has increased more than white life expectancy in recent years. In fact, since 1990, the gap between black and white life expectancy has been cut in half. I've added to the same figure now the change over over 20 years in life expectancy for black women and black men. So to the orange bars that were white women, the dark blue bars that were non-Hispanic white men. I've added the yellow bars, which are black women, and the blue bars, which are black men. And what you'll see is there is a marked improvement in this period for black men, that they actually have the largest increases in life expectancy. Of course, they started at the lowest level, but they did have the largest increases. And after that, the increases for black women were generally larger than those even for white men. And it's white women, non-Hispanic white women, who have had this decrease in life expectancy. But while the overall gap between blacks and whites has lessened, it doesn't mean that there are not still major gaps. So this is the gap in black-white life expectancy. It's not a change, it's a gap, and it's the difference between black-white life expectancy. And what it shows is that whites at each educational level actually have a life expectancy that is 2, 3, 4 years longer than blacks at the same educational level. So even controlling for education, then, there are major differences between black and white life expectancy, except for those with the lowest level of education. Their life expectancies are fairly similar for blacks and whites. Now, one of the things that people have really noted in recent years is this distribution of mortality around the country, and this idea that place matters, and that the trends are quite different in different parts of the country. So Jennifer Montez and her colleagues have taken a state-level approach to looking at mortality, particularly women's mortality, and they have noted how it is worse in the middle of the country. The worst levels of mortality are the red states there, and you'll see those are in the middle, and the best levels of mortality are the green, which are more mountain and Midwest states. Other people have looked at change over time in county-level mortality. One of the shocking things is that all the red counties in this map are places where over 30 years female life expectancy actually declined. And those red areas are areas where health problems are really the major issue for people living in those counties. You see the wide swath of red, and 30 years is an extraordinarily long time to actually have no improvement in life expectancy and to actually have decline. Certainly the people are different over 30 years, but the fact that there's no improvement is something that is really quite shocking. What have the explanations been for these differences between the U.S. and other countries and for trends in the U.S.? One of the things that is most notable about the U.S. situation is that much of it is due to what is happening before age 50, not in old age. And that I'll show you a slide to indicate that shortly. The trends in those in life expectancy for people over 50 have been very affected by smoking history in the U.S. And our analysis of that showed that this has played a major role. So cohort histories of smoking are not forgotten by the bodies of the cohorts. They actually live long within people and actually have a long-term effect. Obesity may be the new smoking in the U.S., has had an effect on reducing our life expectancy relative to other countries and will probably continue to have an effect. Certainly access to medical care has some effect, particularly among the younger population. Among the older population, it's not as big. But most people have come down with statements about U.S. policies in general being not supportive of health as well as health care, and that the social safety net is basically lacking in the U.S. That leads to a healthier society. I said that I would show you something about the age differences between the U.S. and other peer countries. This came from the National Academy report, Shorter Lives, Poorer Health, which Steve Wolf is the major author of. I think he's here somewhere. Among our peer countries, and in this case we looked at 17 countries, we ranked each age in terms of mortality. So a country could rank anywhere from 1 to 17. Well, the U.S. ranks either 16th or 17th at every age until you get to be old. So once you get to be old, and quite old, we're up at the top. We do extraordinarily well. But before that, we do extraordinarily poorly. And that, I think, is very symbolic of what's happening in the United States. The recent trends that have been prominent in the press have talked about rising death rates in the last few years for middle-aged white Americans. This is a headline by a Gina Colada piece in the New York Times. It is discussing this paper by Ann Case and Angus Deaton on rising morbidity and mortality in midlife among white and non-Hispanic Americans that came out in 2015, and I think brought to the attention of some people at least this idea that the United States was not doing very well relative to other countries. So Case and Deaton looked at specific age groups in middle ages, and here's a graph for those 45 to 54. The U.S. is the red line, and this is whites in the U.S. And what it shows is how in this age group, mortality for the U.S. has been increasing relative to other countries. Every other line is a country: France, Germany, the UK, Canada, Australia, Sweden. They're all going down, and the U.S. is rising. And they have made common parlance this idea of deaths of despair being the source of this increase in the U.S. mortality. These are death rates from drug, alcohol, and suicide, and they compare the U.S. to these other countries, and what you see in the U.S. is this rapid rise after the year 2000 in these deaths of despair, and the other lines are other countries, and in most countries, they are either flat or down, or if there's a rise, it's relatively slight. And the U.S. has a level that is far above any of our other peer countries in these deaths of despair. They also have made the case that it's not just a small age range, it's the entire middle age range that have had this increase in deaths of despair. This is a set of lines that indicate increasing death rates from these deaths from ages 30 to 54 by small age groups. They're all parallel to each other, indicating that across this age range, you have increases in these causes of death. Now, one of the major reasons that we have these increases of deaths from despair in the United States is drug overdoses. And Jessica Ho has done a number of articles outlining various characteristics of this drug overdose problem, which really is a relatively recent problem. What I have on the slide is a figure from her article that shows the increase over time. So each set of bars goes from 92 to 2011, and for two populations, first the total population and the non-Hispanic white population. First, what you'll notice is that the bars on the right are higher than those on the left, meaning this has been a greater problem among the non-Hispanic white population, but I understand in more recent data this is starting to change. This has been a problem that is greater among those with low levels of education. So within each set of bars, there are educational differences, and the dark orange are those with less than a high school education, up to the green, which is a college education. And what you see is how high the bars are and how much increase in the bars there are. These are for women with a low level of education, for those less than high school. And these are non-Hispanic white women. So these are the women who have had decreases in life expectancy in many counties and overall have influenced this this overall decrease in life expectancy for this low level of education group. But it's not just deaths of despair directly. There are indirect causes. There have been increases in mortality from liver disease. Now, some of that may be related to drug usage, but it's a cause that's been increasing. There have been increases in maternal deaths. The United States has the highest level of maternal deaths in the developed world. There's no reason for these kinds of deaths to occur at this level. It may be partly related, again, to drug usage, but this is a cause of death that we should be able to control with proper care, and it's been only getting worse. And you'll see how the U.S., again, in red, is just an outlier from all these other countries that we would consider our peers. The major cause of death in recent years continues to decline, and that's cardiovascular mortality, but the rate of reduction has been more than cut in half. So if you couple the really reduced rate in cardiovascular mortality with this rising rate in other factors, that's what's contributed to our very poor showing as of late. Steve Wolf just published last month a paper in the BMJ, which made the point that the trend in the U.S., it's not just non-Hispanic whites, that there are recent adverse trends for other groups, and he points out even most recently that black mortality rates may be adversely trending. Certainly American Indians and Native Americans are adversely trending. And he also noted that it's not just deaths of despair, it's other causes of death as well as deaths of despair. So I think this is an indication that things are getting worse across the board in the most recent years. How about our peer countries? Did the same thing happen to any of them? What Jessica Hogan and Arun Hendy looked at 18 countries to see whether any other countries had actually had declines in life expectancy in this recent period. And they compare young people on the left-hand side with older people on the right-hand side, and they compare the U.S., which is orange, with all these other countries, which are gray. And what they find is that many of these countries actually did have some decline in life expectancy in the first year that the U.S. had a decline in life expectancy. But then they recovered. They almost all recovered more than they had actually lost. And so in the end, they were ahead of where they had been 2 years before that, whereas the U.S. continued to decline. They also discovered that the causes of immediate change in life expectancy in those years were very different. So in other countries where you actually saw a decline in life expectancy, they had a decline in older ages and from respiratory diseases, whereas in the U.S. what we're seeing is a decline at younger ages and from opioids and other external causes of death. So there was some similarities, but major differences in the age and the causes of what was happening. Johann Mackenbach and his colleagues have also compared the U.S. and Western Europe to see whether after the economic crisis, things got worse in Europe the way they had in the U.S. So after the economic crisis in the U.S., we have an increase in inequality with any improvement taking place in the highest education categories and deterioration or stagnation in the lowest education categories. So Johann Mackenbach compared the trend before and after 2008 in Western Europe, and the earlier trend in terms of the rate of mortality decline is in blue, the later trend is in orange, and it's by age group. And what you see is the two bars are basically the same, meaning there was no change in the trend in low education people in Europe after the economic crisis of 2008. And as you'll recall, there were many European countries that actually had a much more severe economic crisis in that period, but it did not result in a change in the decrease in mortality or increase in life expectancy for those with low education in those countries, as it did in the U.S. So in sum, the current situation in the United States is worsening relative to peer nations. Many inequalities within the country are increasing, although the race inequality is decreasing, as is the gender. But there is deterioration in multiple aspects of health among some groups of the population. So there are proximate causes that are amenable to interventions. There is some evidence of increasing despair. Noreen Goldman and her colleagues looked at trends over time and what they would have in mental well-being, I think I would call it, using a relatively small sample in the U.S. of white non-Hispanics in the MIDAS sample, and they found some increase in poor mental well-being. The opioid epidemic has had unusual characteristics, which are related to the distribution of drugs and sudden unexpected deaths, so there are certainly ways to treat that epidemic. There certainly is a lack of or inappropriate care for some conditions, such as maternal mortality. So those are proximate causes. But what about the root causes of adverse trends? And I will say that everybody that has investigated this has basically come down to the idea that in the United States, it's the root causes of adverse trends that are important. It's the macroeconomic changes that result in job losses in some sectors with no programs to alleviate those problems. Income stagnation for large segments of the population, family stresses, and a lack of supportive social policies. That's what really differentiates us from our peer countries around the world. What to do about it? I thought we were going to have a bill introduced last week on a national strategy to increase life expectancy, but I think it was a week with news cycles that nobody wanted to get involved in competing with, and so I suspect it'll wait till this news cycle is over. But I think it has finally reached this message, the message of the problems in the United States have finally reached some of the people in Washington that can actually bring attention to this problem. So hopefully by next week there will be some, or the week after, there will be some introduction of this idea of a national strategy to increase life expectancy, because I think that's what it's going to take. It's going to take people really believing that people have a right to health care, that people have a right to health, that people have a right to jobs who can work, and that people who can't work have a right to support, that families have a right to support, and that those are the ways that you're going to improve health in the United States in order to get levels of health that are in any way commensurate with our peer countries. Thank you.